Visiting a urologist varies many men. However, if you don't get examined, there's the risk of leaving a potentially threatening cancer undetected. To alleviate your fear of visiting a urologist, we are happy to inform you about the prostate examination. The examination consists of the conversation before the exam, the palpation of the prostate, potentially an ultrasound of the prostate, and a blood collection for the so-called PSA test. Urologists are very much aware of our patients' worries about a prostate exam. Therefore, it is important to create a pleasant atmosphere during an initial conversation. The conversation includes questions about the general health status, current medication, previous illnesses or surgeries. Specific urological questions relate to urination and sexual function. Also, we are asking about family history of prostate cancer. After all open questions have been discussed, we proceed to the actual exam. The prostate is located below the bladder and close to the rectum. Therefore, it is possible to palpate the surface of the prostate with the finger from the rectum. No specific preparation, such as a bowel cleanse, is required for the palpation of the prostate. Before the actual palpation of the prostate, the male genital area, which is the penis and the testicles, are examined. Following the examination of the genitals, we ask the man to turn on his side into a so-called embryonic position. For the palpation, the urologist uses a glove that is covered with lubricant. This makes the exam painless for the patient. During the exam, the urologist checks the size and surface texture of the prostate and determines whether there are any hardenings. The exam takes less than 10 seconds. Following the palpation of the prostate, the urologist may perform an ultrasound. The ultrasound is performed with a special ultrasound probe, which also can be inserted into the rectum. The ultrasound exam allows the prostate to be examined more closely and the size of the prostate to be determined. This exam takes about 20 to 30 seconds. An important part of prostate cancer screening is the so-called PSA test. PSA stands for prostate-specific antigen. It is a protein that is formed in the prostate and it's responsible for liquefying the seminal fluid. A disadvantage of the PSA test is that there is no exact upper limit, and increased PSA can also be caused by other reasons, such as a benign enlargement of the prostate or a prostate inflammation. If the rectal exam and the PSA test show inconspicuous results, a re-exam is recommended after 1 to a couple of years. The interval of the exam depends on the level of the PSA test. If the palpation shows some hardening of the prostate or the PSA value is elevated, there is a need for further investigation. In recent years, magnetic resonance imaging, so-called MRI of the prostate, has become a standard investigation. This imaging can detect areas in the prostate that are suspicious for cancer with great accuracy. If this exam suspects cancer, a biopsy of the prostate is necessary for further clarification.